Okay, so a question I get asked a lot is what should you carry in your first aid kit? Now this first aid kit I'm going to show to you here is one that I carry when I'm going remote with my horses. So there are some items that are a bit bigger than you would need to deal with a human incident, but it covers both for me. So I'm a paramedic and I thought it would be a good idea to talk through what I carry. So it's a standard first aid kit. It's nice and compact, so it fits well in a rucksack or a saddlebag. On the back here I've got easily accessible gloves because they're the first things you want to use to protect yourself and your patient at an incident. And then also inside here I've got a pair of tough cut scissors. They're used to cut through absolutely anything. And then if we open the main compartment, again, got something really accessible that you need early on in any first aid incident, some hand gel. And this is some vet wrap. This is used for horses primarily. It's kind of like a sticky bandage that sticks to itself, but it's good for humans too. So I carry that with me. Again, quite accessible. I've got some extra gloves. And then in here, I carry a notebook and pencil just to write down any observations I'm making on a human or horse. I've also got some duct tape, which is good for improvising in any situation. I usually carry more than this, so I'll have to replenish this before I next go out. In here I've got some items to deal with bad bleeds, so I've got like an advanced clotting agent, I've got some glue for gluing wounds if you know how to do that, and I've also got some steri strips for, again, holding clean cuts together. Okay, inside the next compartment we're still kind of dealing with bleeding. I've got a variety of bandages, triangular bandage, and some gauze at the back there, things to soak up some of the blood before you put a bandage on, and to clean a wound before you put a bandage on. I've got a small iPad, not the kind that you carry with that needs electrics, but an iPad for dealing with an eye injury. I've then got a variety of plasters and some alcoholic wipes. I'm not going to close all this up because that would take a while. In the next one here, I've kind of got some medication. So I carry some glucose gel for if anybody gets low sugar. I've got a thermometer. In here I've got some self-medication, but also some medication that you might use in an instance, such as aspirin for somebody maybe suffering a heart attack. I've got some paracetamol, some antihistamine, some anti-indigestion type things. I have a face guard for any resus incident. I've got some horse painkiller Butte, and also some anti-inflammatories for myself, which is ibuprofen. In this little section here, I carry some tick removers. It's very important if you're working in Scotland. I carry a little device for dealing with any bad bites I get. It gives you kind of like a little electric shock, and I find that that really helps to soothe the itch rather than taking lots of antihistamines. And then, because I do an awful lot of walking beside my horse as well, then I have some Compeed for dealing with blisters. Try and catch them early on is my tip. At the back here, I've got some what we'll call big plasters. Really, they are they're adhesive, non-stick kind of big plasters for covering big wounds. Very good for burns if you've burnt yourself on your stove. And that's it really. That's all I carry, apart from if I was going really remote and I was worried about sort of bigger incidents happening. Then I tend to take also with me in a Ziploc bag a bigger trauma dressing or two, and some cling film, which can be used for a lot of things, but again is very good for burns. Hope that's helped you decide what to take on with you. Honestly, it does all fit back in. Thanks for listening.